Are mpox outbreaks usually like clade 1 versus 2, or is this why is this so
Yeah.
so number like 2 is unusual, or
We had clade 2 was the cause of our outbreak.
oh, I see. Oh, they're clade 1 and
Yeah.
DRCS.
It's something we never.
I see. Looking forward to it. Right. But I mean, even the patients, sizable amounts. Yeah, we'll get started. All right. Hi, everyone. I'm Abhijit, one of the chief residents. Today's chief invited grand rounds. We have Dr. Nick Staub here, who I'll introduce shortly, but kind of, we have 2 other chief residents in the room here, Lauren and Carly. Start thinking about your chief grand rounds. No, I'm just kidding. It's fine. You have time. But I was working in the hospital med office earlier in the year, and Dr. Hartley had tasked us with this kind of like endeavor to do a chief grand rounds. And I was like, oh my gosh, what am I going to do? And I thought, oh, we have this amazing epidemiologist at our disposal, and he's more interesting than me. So I thought he should be the one to speak. He's going to talk about heat-related kind of illness and injury and death, which is something, we don't really see a lot in the pediatric population. Thankfully, you hear about, news stories of children being left in cars, but, when you think about like a heat-related injury, it's typically an adult who may be unhoused, who's been in the heat for a long period of time, but Dr. Staub will get into all of that. So I thought that was something that was interesting that we don't typically hear about, but could affect our patients and their caregivers at the same time. So a little bit more about Nick Staub. Dr. Staub currently works as a medical epidemiologist and is deputy medical director for the Maricopa County Department of Public Health. Previously, he was medical director for the Bureau of Epidemiology and Disease Control at the Arizona Department of Health Services. He works clinically as a pediatric hospitalist at Phoenix Children's here. He has a Master of Science degree in Public Health, Microbiology, and Emerging Infectious Diseases from George Washington University, and earned his medical doctorate from the Keck School of Medicine of the University of Southern California. Dr. Staub's a native Phoenician and lives in Central Phoenix with his young family. So yeah, hope you enjoy this stuff. Thanks, Dr. Staub.
Thank you. I guess you got off kind of easy inviting me. I'm not available for another year, so. All right, so I wanted to come just because I think it's timely to talk about heat and talk about our heat response, talk about what we do for heat-related illness and death surveillance here in Maricopa County. Last summer was an extremely hot summer. But that's not unusual for us. It was certainly record-breaking, but our response activities and what we do to respond to heat and monitor its effects on our population are the same. We got a ton of media attention last summer. We did about 100 requests for media interviews over the course of the summer in our heat season, got coverage internationally and nationally. And luckily, from our perspective at Public Health, a lot of it was good in terms of what we do to monitor and keep track of heat, of our heat risk here. But what's not good is the severe impact it has on our population and kind of the length we need to go to continue to think about this and protect our population. So I will just give you guys kind of an overview of what we do to track it, some of the data that we have and how we're using that to plan for this summer. Then I'll touch on a few other topics just of public health interest, things we're tracking. I like to keep this pretty relaxed. So if anything strikes your interest, if you have a question along the way, please go ahead and just ask me. I'm sure Dr. Hartley is monitoring those who are joining online. So if you have questions, go ahead and ask. Just by way of introduction, I am a native Phoenician, grew up here. And so the issues that affect both Maricopa County and Arizona in general are of particular interest to me. Went around the country, have trained in a lot of different areas, Washington, D.C., Chicago, LA. And so I have brought that experience and kind of what affects patients and populations in different parts of the country back to my work here. As Abhijit mentioned, after being full-time here at PCH for a number of years, a couple of years ago, right before the pandemic, I transitioned back to public health, first at the Arizona Department of Health Services, and then now at Maricopa County. So that is a bit of my background to give you guys some context for how it is that I got to where I am and why I'm speaking to you today. So this is just a press release from last summer in 2023. We were actually doing a fair amount of media before it got very hot here, because as you will see, our trend in heat-related deaths has just been going up each year. So we're really trying to call attention to that, and then realized during the peak of last summer's heat that we were very close to hitting that mark again, and then far surpassed it. So again, just ended up doing a lot of media last summer. And this is what the summer looked like. So this is our heat-associated deaths. Our heat season runs from April through October. It's really long. We talk a lot about heat being kind of our natural disaster, and so our natural weather disaster. And so the way we respond to it is really kind of thinking of it in terms of the same way that other jurisdictions respond to those disasters. But a hurricane, a tornado, all those things happen in a discrete period of time and then are over and you recover. Heat here is very long and it requires a sustained response. And so that is why, now and moving forward, we, the state, other local jurisdictions are standing up in kind of like an emergency preparedness stance for our heat season. So this is our epi curve. Those are heat-related and heat-caused deaths. So that's really just where on a death certificate or on a death record heat falls, whether it's a primary cause of death or a related cause of death. And so really our overall numbers aren't really different, but we do track that. You can see here that still at the end of the last season, when this report came out, there are a number of cases that were still under investigation by the medical examiner's office. All of those have now since been closed. But we did end up with a total confirmed cause of death of 580, near 580 cases. Sorry, 645. There we go. This is the complete data here. So that shows you the total number of heat-related deaths since 2013. We've been doing our heat surveillance since 2006. But you can see where we were concerned last summer and really kind of trying to get the message out a lot was this 20% increase in 2022 over 2021. And then last summer just far surpassed that. Here are heat-related deaths by day and also high and low temperatures. The red dots are record high temperatures. You all will remember if you were around last summer and not just stuck in the hospital, it was hot outside. And in July, we had just this very long stretch of high temperatures. Not only were they very high temperatures, but our low temperatures were also high. And so when you think about the data I will show you about who is at most risk for these heat-related deaths, it's really those high overnight temperatures. that are affecting people, not giving the body time to cool off or recover. And then obviously day in, day out, being exposed to those high temperatures, really you can see here the result of that, which is this peak in cases. You can see, during those days in July, we were seeing more than 20 cases a day of heat-related death. So as I mentioned, we have a pretty comprehensive surveillance in place for heat-related deaths in coordination with the Office of the Medical Examiner. Each of these deaths that gets reported gets investigated, and we look into what those risk factors are, what the circumstances of the death were. And again, we've been doing this since 2006. It's been an iterative process as we go along, as there's new data elements that people are interested in. We will add those to our investigation process. But I have found out that this is pretty unique. A lot of other jurisdictions, even those who may have significant heat-related issues, significant heat, don't necessarily have this level of data. So it's really helpful for us in kind of coordinating our response. It certainly has informed the national conversation about heat. So looking at last summer, 72% of our heat-related deaths occurred on days with an excessive heat warning. One of my talking points previously had been that they weren't. And so I think last summer really kind of changed things in terms of the high heat that we had. The point that I was making last summer was you don't have to have a warning to be at high risk. Again, we have a long heat season. Our deaths start to be reported, heat-related deaths start to be reported as early as April, and then run through all the way through October. So one of the messages that we get out there is that everyone who lives here is exposed to this heat and is at some risk of heat-related illness and death. And so it's really something we need to be planning for every day of the summer, not just on those days when we're told that it's going to be excessively hot. Yeah. That is something we have. I don't have it off the top of my head. Right. So a lot of what I'm going to show you today is pulled from our heat report. So it's a 20-page document you can find on our website. It goes into a lot more detail about those types of things. So how many days. So if you have interest, I really recommend you go take a look at it. I just kind of pull out a couple of things that I want to highlight here. But yeah, I mean, last summer was we almost need to like go back to how we're talking about these warnings, right? Because literally last July was entirely excessive heat warning. So then it doesn't really help you understand, when are you at higher risk? Unfortunately, I think you're just at high risk that entire month. And so, whether or not you adjust that scale to have a more reasonable number of days, because I think that's reflected here, right? Because we just had such an awful summer. So I don't know if this data is telling us as much anymore as it did before. I still like the point of really just saying, like, we're all at risk. We all need to have a plan for how we're going to stay safe during excessive heat. Looking at demographic breakdown for heat-related deaths, about 3/4 are in males. And then when we look at the breakdown, most of our heat-related deaths are in individuals 50 and older. So we definitely see an increased risk in the elderly population. But we still have, a quarter in middle-aged adults. That is pretty significant. And again, we see relative sparing of kids from heat-related deaths, and that's great.
Was it really zero last year, or was that just the graph doesn't include kids?
It was really zero. So again, this is part of our surveillance. So I don't know if there's just something that we're not capturing in pediatrics in terms of how heat is related to any deaths that we see. or if it's something about like injury, because we were talking about kids who unfortunately are left in cars, and we hear about those cases every year. Those may not be captured in our investigation process because they may be excluded as some other kind of injury. But it's definitely something in preparing to talk to you guys today. I was like, it struck me as this is the case. This is interesting. So we look at how long individuals have been residents of Maricopa County. And it's interesting to me that the large proportion have been here 20 or more years. I think there's this thought that people are at higher risk if they have not been exposed to this kind of heat for many years, that the longer we live here, we become accustomed to it. We have ways of dealing with it, and our data does not support that. Our data shows that individuals who are dying from the heat have been longtime residents. So we can't think that just because someone's lived here a long time that they know how to deal with the heat or are safe from it. And I think that's especially true when we start to think of our elderly population and how we're doing outreach to them and making sure that they are staying safe during the summer. We know they're at high risk and that they truly are not becoming more tolerant of the heat as this data suggests. So a couple other things. So again, highest risk amongst men, most of these deaths in elderly folks, African-American and Native people are overrepresented. So again, smaller numbers, but relative to their population in Maricopa County, they are overrepresented here. We look at other comorbidities. So nearly half had heart or lung disease. 45% of individuals were experiencing homelessness. So we see that as a major risk factor. And then not surprisingly, but really complicating this issue is that 2/3 of our deaths involve some kind of substance use. So that is really, I think, where we need to focus a lot of our attention in terms of how we're responding to this crisis, is looking both at kind of that cross section of homelessness, substance use, and then the risk for heat. As I mentioned, we look at the circumstances of these deaths. So we look at where the deaths are occurring. In 2023, 75% of those deaths occurred outdoors. So again, when we look at individuals who are experiencing homelessness, we're really concerned about how do we get those people a place to get out of the extreme heat so that they can cool off. 6% of deaths were related to some kind of physical or recreational activity. So again, I think that is kind of overemphasized in this story, is how to really stay safe if you're if you're a hiker or runner. We're not seeing deaths in those circumstances. So again, very important to do those things safely during the heat, but that's not who is at highest risk. And then a big point that we make here is that 75% of our indoor deaths, so again, a minority of deaths that we're reporting, but a significant number were discovered when people did a welfare check. So we spend a lot of time asking people to check on their neighbors, check on their family members, loved ones, especially the elderly, because we know that a lot of these individuals end up dying alone and then are later discovered. So it's really an important message to get out there as we're talking about planning, is thinking about those people in your life who may be at risk and what your regular check-in is for them. Yeah.
In Colorado, I know they open the shelters to everyone, like kind of over office space, so like what they don't typically have when it's the floats or anything. But it's not here, like,
Yeah, so I will talk about our response and kind of how we use cooling centers and how we're trying to expand accessibility to respond to this. Yeah.
There's the health department is working with
ASU and their ethics program. They have a group of biomedical science engineers that are working on this device that actually plugs in to elderly people's homes. When the temperature gets above a certain temperature, it actually sends emails and text messages to their loved ones, which is actually a really cool project that I'm happy to be working with them on with ethics in a different project, but I thought that was one of the coolest projects I saw that showcase recently.
Yeah, I mean, it totally makes sense, right? As the technology becomes easier and relatively cheaper, we could roll those things out. We, as we think about who we're working with in the community in this response, some of those organizations are like Arizona, AAA, Arizona Aging Agency. Anyway, just trying to partner with them and thinking about ways that we can interface with their constituency to make them safer. Here's our data on individuals experiencing homelessness versus housed. You can see, in many ways, year to year, the distribution looks kind of similar, but you can certainly see that from certainly the mid 2015-16, we've definitely seen an increase in this proportion of folks who are unhoused. And again, I think that reflects what we're seeing in general in the county in terms of our homeless population, as well as I'm sure it's reflective as we think about the impact of the opioid pandemic in our community. I think we're seeing all those risk factors kind of come together. Yeah.
I saw a study that map of Phoenix, and there's like a correlation between the amount of trees planted and the highest trees and more of those trees that are like that was whereas the towns don't
Yeah, I mean, so this is as we look at social determinants of health and all that, like it all comes to play here. So there's really, as I review this data, nothing is extremely surprising, right? And where we see, I'll show you a map where we look at our deaths by zip code. We know where those highest risk zip codes are. We know that there are other social determinants of health that are coming into play there. And it's all the same impact. So as we think about how we're responding to heat, it's not independently our heat response, right? It goes with how we're responding to housing and how we're responding to opioids and all that. So in some ways, it's helpful that they overlap because we can kind of really focus our response, but it also makes that response extremely complicated. Yeah.
Somebody's texting, please repeat the question.
Sorry, yeah. Let me summarize this question. So the question is, as we are seeing changes in our homeless population, do we expect to see those changes in our data, specifically in terms of clearing the zone and kind of trying to, that population got relatively dispersed. And so I think, so I'm not a human services expert, but yeah.
whether or not, like, or seeing as whether or not they
So the question is whether clearing that area was helpful. I don't think we've seen that yet because if I'm recalling, that all happened between last heat season and now. The zone was, and I'm speaking a little bit out of my lane here. The zone was strategically placed because of folks' access to the human services campus downtown. So when you think about what the zone did, is it was a place where people could live and have access to those to those services. So now that they're relatively dispersed, how easy is it for them to access services wherever they went? I think it's probably harder. Are we going to see that reflected in terms of where people can have a place to go to get out of the heat? I think we probably are. So until we really start to think about putting those services in a place that's accessible, my biggest conundrum personally is how are we going to take care of people who are using substances, right? Because we see that there are a significant proportion of our heat related deaths. How do we get a space that is cool that they can access? And I think that's going to be one of our biggest challenges moving forward, both from a planning perspective and politically. It's just there's not a lot of will to do that. Yeah, here we go. So this is the 65% I'm thinking about. And our major initiative to respond to heat is to expand access to cooling centers. So for a long time, the Maricopa Association of Governments has maintained the Heat Relief Network, which is a loose affiliation of organizations, community-based organizations, municipalities who are running these cooling centers, essentially opening up a space for people to go and cool off. Strategically, we like to make sure that they're in spaces or in places where we see people who are at highest risk, but it's often just based on the goodwill of these organizations and these cities to set up these centers. And accessibility to individuals who are high or using substances obviously is limited. And everyone can understand if you're opening up your space and inviting people in, that you want that to be a safe space where other people are feeling comfortable to be there. And so this is just, I think, a really challenging area to think about how do we serve people who are in this risk area. Obviously, we work a lot with agencies like Sonora Prevention Works and kind of thinking about where they are doing their activities out in the community. How do we work with them to make sure that people are being, if they need a place to cool off, being referred to our Heat Relief Network. So specifically looking at indoor causes of death, 25%. So again, a minority. But I think there's a lot of space here to move and decrease this percentage. So again, in these indoor deaths, we're looking primarily at the elderly over age 65. 25% are living in some kind of like temporary housing, RV trailer, or mobile homes. Are really focusing our efforts on those communities, making sure that they have resources, that they know where they can go if they need to get out of the heat. Or get one of the devices that Dr. McGreevy mentioned. Really, we have added over the years a lot more information into our investigations about air conditioning, because I think there's a story out there that some of these individuals don't have electricity, or the power company has turned off their electricity. We have worked in Arizona over the last 10-20 years with our utilities to make sure that that is not the case during the heat season. And so what we find is that a lot of these situations do have air conditioning, but that those air conditioning units are not functioning, so they're in disrepair, and in a minority of cases they're just not turned on. But I think really trying to get at this 85% here, where the air conditioning is there and it's not functioning, really trying to figure out why, and getting resources to folks to make sure that those units are functioning properly. And again, a highlight here that 3/4 of these indoor deaths are discovered during a welfare check. So it's really just trying to keep an eye on folks and make sure that they are safe in their homes. So I mentioned our main tool in this response work is on our cooling centers. So cooling centers generally are public spaces that people can access usually during the day. And they use them for a couple hours, especially during the highest heat of the day, just to cool off. And so because that is our major effort to respond to heat, we wanted to get some more data on who was using cooling centers, how they were using them, what they were looking for and what they needed in terms of services. And so last summer, we did a big push to get surveys out to folks who were using cooling centers. It was actually two-armed. We did a general public survey as well as people who were using the centers to try and better understand what the needs were. And so we had about 1,000 responses to the survey. These are people who are using cooling centers, not the general public. We had about 1,000 responses in both. And so we're seeing that, again, the highest use is amongst people under 65. So when you really think about that high-risk group who's over 65 and succumbing to heat in their homes, it would be, we really want to focus on this 15%, really kind of increasing accessibility to the elderly. And again, we see 60% are unhoused, which is not very surprising. I think, you know, this 20% that's living alone, again, room to increase that. These are really people we want to reach out to, make sure that they have transportation to a cooling center, and that they know where one is nearby if they need it, especially when we see that high percentage of air conditioning units that are not functioning. You know, if that's the case, then those are people who need to know where they can go to get out of the heat. Yeah.
How did you guys deal with people?
That's a great question for my epidemiologists.
Repeat the question.
How do we, how do we deal with people who fell into multiple,
Like a disabled home.
they would be counted in both or in all. So this is not a sum total. This is just of the respondents to the survey, what proportion reported that they were unhoused, disabled, living alone. So they certainly could be represented in multiple places. Primary reason, so when we asked the general public the same survey, the reasons that people didn't use cooling centers were that they were unaware that they existed and that they didn't have transportation to them. So we found that most people who used cooling centers got there on foot. And so if you just can't get to a cooling center on foot because you are disabled or elderly, you know, we really want to put into place an easy way that people can access this network. And then we just need to publicize it more. So how can we get this information out to those individuals who are at highest risk? Again, they probably are not listening to me doing an interview on local news. And so we need to make sure that this information is getting to those community organizations that can get it into the community. Other issues we saw here, so they're not open when they needed it most. So we found that a lot of our cooling centers were kind of working on business hours and they were closing at 5 o'clock. And we all know that during the summer, it's still really hot at 5 o'clock. It's hot until, well, it's hot all the time. But we know that really until the sun goes down, those extreme temperatures are dangerous. And then just other issues were not having effective signage. And again, just need to get more information out there that this network exists. We asked visitors of cooling centers, you know, how did they find out that it was that a cooling center existed? So word of mouth and then street signage were the most common. So we are working this summer to, again, in those areas, how do we get the information out to community-based organizations to share? So we are developing flyers, pamphlets, cards, that organizations can give to people who are, who they, serve, to make sure that they know, how to find a cooling center. We are working with 211, which is kind of the general, assistance line, locally here, to make sure that their staff knows how to refer people to cooling centers. So I'll talk a little bit more about that in a bit here. Again, as I mentioned, respondents needed kind of more availability in terms of the time that our cooling centers are open. And they really said that the need was from 9 to 7. And so that has been a focus of ours in supporting these cooling centers to expand their hours to include the afternoons and evenings. Again, most of our respondents reported walking. We know that a number or that many use public transportation. So we've been working with Valley Metro to make sure that that organization, the bus drivers know where the cooling centers are. So if people need them, they can get that information. So as we look at our response this summer, as I mentioned, one of our primary goals is increasing transportation to cooling centers. So through 211, we are giving them additional staff so they can really support this effort. So this is during the heat season. People can call. English and Spanish is available through 211. And they can be directed to the nearest cooling center. We are also, through our Department of Human Services, they have air conditioning repair and kind of support programs. So through 211, individuals who may have air conditioning that needs repair, they can get access to those services. And then we are providing transportation through 211. So if a person calls and needs to get to a cooling center and needs transportation, 211 is going to help support that. We know that we need increased visibility of our cooling centers. So we're working with the city of Phoenix, beyond the city of Phoenix, to make signage that is available or that is on the street outside of the cooling centers. So I think I have started to see that. May started this program, and so you should see increased signage outside of cooling centers. We like to map everything. And so here is our cooling centers, are the blue dots with the little blue kind of shading around them. And then here you can see our outdoor homeless deaths from 2023 and 2022. So in 23 are the yellow dots. Again, really hard for you guys to see here, but the point I'm trying to make is that we use all of the data that we get in our investigations to help inform our programs. So we have community liaisons who are working for public health, but out in the community. When we see areas that are not served based on this kind of mapping, we reach out to community-based organizations, try and find a space that could operate as a cooling center, and then support those organizations in setting up. So I think to your question about the zone and looking at, we do see a lot, we do see a concentration of our heat-related deaths in Central Phoenix, really kind of along the I-17 corridor, and then on the 60 heading east out of town. And so that's really where we're trying to work with organizations, making sure that we're opening up cooling centers to support them. Again, as I mentioned, we have funding opportunities for community-based organizations who are trying to expand their hours of operation, really focusing at being open from 9 a.m. to 7 p.m. And so the kind of grants that we are putting out to these organizations are reliant on them being open those hours. Also trying to expand access on weekends. We know that weekends tend to be times that these centers are not open. And we certainly know that the heat does not stop on the weekend. Last summer, kind of late in the summer, the governor did declare an emergency related to heat. That opened up some funding streams to local jurisdictions like Maricopa County to expand our response efforts. Unfortunately, there's not as much money here as we would hope for. Someone mentioned something, Colorado in the cold. So it's really interesting when you look across the country at response to extreme temperatures, the amount of funding that goes in to support local jurisdictions in their response to the cold is way off in terms of those of us who are responding to heat as our weather emergency. So one of the things that our Arizona officials, national officials, the governor are doing are really trying to even that playing field, say, you know, we need response dollars for responding to heat in the same way that other jurisdictions respond to the cold. And we always want more data. There's a lot of interesting data sources to look at that we're just starting to explore. So one of those is our 911 call data. So looking at where 911, where local emergency responders are responding to heat, both heat-related illness and death, trying to get that data so we can overlay it with our data. So we're working on that. And then we will be repeating the cooling center survey that we did last summer, this summer, to see how our data is changing over time and how effective our programs are. I have some other fun things to talk about, but it's 8:15. Any questions on heat response? One other thing I'll just mention in terms of your question about Colorado and shelters, cooling centers, as we define them, are distinct from shelters. Cooling centers are just a space where people can go and cool off. Respite centers are a place where people can go and sleep, but they're not necessarily open overnight as a shelter would be. Shelters will house people overnight. Many shelters in Arizona are nighttime shelters, and then they'll close for a period of time during the day. What we have seen in previous summers is an expansion of those services to stay open all day. And so we certainly support shelters. Our response from public health is really focused on cooling centers and respite centers. And then in Maricopa County, our human services is separated from public health. And so the human services department is in support of those shelters as they expand their hours of service. Because I'm here talking to you guys, I just thought I'd mention a couple other topics that public health is following. Avian flu, HPAI is in the news. We've been doing a lot of coordination across the state and with federal partners looking at HPAI in dairy cattle. I've learned way more about cows in the last month than I ever thought I would know. When turkeys get HPAI, they get very quiet. So that's been one of the messages that has been going out to turkey farmers, that if your turkeys are quiet, you may have a problem. So far, the surveillance in dairy cattle has only shown positive cases in 9 states. We have not had any cows test positive in Arizona. Testing of cattle is now a mandatory report to here in Arizona to the Department of Ag. So if there is a positive cow we should hear about it. The problem is cattle don't get sick necessarily or very sick from HPAI. They can be mildly ill. They have very high titers of virus in their milk, and so that's why we've been testing a lot of the milk supply. But getting this data is hard. And you can imagine if you have a positive herd, you have to, the USDA is requiring that that milk be discarded. And so there's not a lot of incentive if you're a dairy farmer to test your mildly ill cows. The other place that we are now getting data from is any cattle that are cross state lines have to be tested. And so that is how some of these herds have been identified. So far, there's just been a single case of HPAI in an exposed human, and that was a mild case of conjunctivitis. So we are trying to wrap our head around what our response is to this. We know that some of our tested milk supply here in Arizona has tested positive. That's PCR positive. So far, none of the samples that have tested positive have had viable virus. So we really do believe that our pasteurized milk supply is safe. Raw milk is legal for sale here in Arizona. So there may be some of your patients who are exposed to raw milk. So it's a good time to remember that pasteurized milk is safe, and it's our recommendation. There is CDC is maintaining a nice situational summary on their website if you're interested in following along. The other interesting thing that we're following is an increase in invasive meningococcal disease. These cases are really interesting. They all, or most of them, are serogroup Y. And they're presenting not as like classical meningitis. So we're seeing a lot of joint infections, other bloodstream infections. In Arizona, as in the US, we're seeing this increase in middle-aged adults and a higher risk factor amongst Black and African American people. We are seeing the same data in Maricopa County. Our cases are just less, so we rely on state and national data there. But the good news is if you're vaccinated, you're protected against these infections. And so we've got good messaging to make sure that people are staying up to date on vaccines. But we all know the challenges there as well. And then the other thing I was going to mention, just because it's interesting, is there is a outbreak of Mpox, formerly known as monkeypox, in the DRC, and it's a clade 2 outbreak. So there are 2 clades of Mpox, clade 1 and 2. Our outbreak of 2 summers ago was clade 1. What's interesting about this outbreak in the DRC is that it's primarily affecting women and children. So the most severe infections, hospitalizations, and death from Mpox in DRC are in children. So I just wanted to bring it up to you because I think as pediatricians, if we were to see clade 2 start to transmit here in the US, which we are monitoring for, then I think it'd be a big change to our messaging currently, our vaccine efforts. So the vaccine Jynneos developed for smallpox is effective or is protective against clade 1 and clade 2. But again, our vaccination efforts in the US have been among men who have sex with men because that is the risk we saw with our outbreak of 2 years ago. So it would be a pivot, certainly, if we saw it. So just something else we're monitoring for. So that is all I have. I'm happy to take questions.
Good.
Yeah.
Q&A.
Okay.
First one, please repeat them. With record numbers of people crossing the border, what percentage of these deaths are related to immigrants? That's a population we may not be able to have much impact.
So question is, in our heat-related death surveillance, what is the impact of immigration, or what is our data regarding immigrants? We do not currently collect that data in our investigation process, so we don't collect information on residency status. So I don't have that data.
Second question, do you have any data on the impact of the Maricopa County Medical Reserve Corps?
Do I have any data on the impact of the Medical Reserve Corps? So MRC in Maricopa County is volunteers who are organized through public health. They're medical and non-medical volunteers. It's a large force and something that we're very proud of is how we're able to use our MRC volunteers in public health operations. So we are using MRC in our cooling center operations this summer. They're available. So if an organization needs additional staffing, they can make a request to public health for MRC volunteers. If it's something you all are interested in, I encourage everyone just to sign up because then you'll start to get information on what opportunities there are for volunteering, and there are interesting opportunities for medical related activities. So just by signing up, you're not obligating yourself to anything, but you start to get more information.
That's good.
Okay. Any other questions? If any of you have any interest in public health or any kind of like your role in public health, have interesting ideas in terms of projects or research, I am always available. All the hospitalists here know how to get a hold of me, and always happy to engage with you guys. So thank you.
Next week is the day after Memorial Day, so we have another.
I ran out here.
They're not in my wheelhouse, right? Like I deal with virtual. But not at the.
You have to be somebody to write. The outpatient doc being like someone might have or something.
Right, yeah, yes. Yeah.
Definitely not in our wheelhouse here because
Right, exactly. Yeah.
I wonder anybody in the allergy. I mean, if we're gonna have anaphylaxis in your office, they're probably the ones that are most likely. I don't wanna be part of it.
Right, because she's got all the truly. Right, that don't have the clean teeth.
Yeah. She in charge of that now?
Yeah, she does all the English children's primary care classes.
Okay. That's that is the art. You're making it.
I mean, I can.
My husband and his
Like-
firefighter colleagues, right?
You're making it.
Natural selection.
I mean, I can think of smaller group that could be good gift. You know, but I think I would need some of the
Right.
Darcy to help give us an idea of like, what's the things that they're seeing.
You know,
Like those sorts of things. I mean, I can make a hypothetical guess about what they are.
Yeah, it's not like.
I probably have a pretty good idea.
That's right. You know, if you ask somebody about suicide, it's not implying that they should
Yeah.
find.
I could come up with some ideas how to manage this thing.
Yeah.
Yeah.
They're not that.
And then
Okay.
when they, I mean, so.
It could be a collaborative, right? It could also be a mix of collaboration, like you said, like, instead of having just one person up there talking about this. You know, like we talked about. The great grandmas, like having
So I just have to open it. I was thinking, do that?
Yeah.
No, I
Yeah.
can't.
You have it, I mean, I'll see if I, Darcy, she should have it. So.
Yeah, she does.
Oh.
Yeah, I need something to do. I already don't have the resident ballot before I had cell phone.
Yeah. Yes.
Okay. And then.
But we do all of that though, right?
So, that I would need to figure out how to.
Yeah.
Start their cheap elective.
Oh, in June.
Yeah.
Okay. Well, I'm on the.
Wait, I want to hear-
Real 2 weeks in June.
Okay.
But.
Move on.
Five.
First year.
I am gonna do my.
June sixth.
So that week of the 24th. If that would be okay.
I would last about 2 minutes.
But the 3rd through the 7th, I don't.
Okay.
May order something this weekend.
Yeah.
Oh,
Yeah.
I was driving it, I got driving it, and I'm to Goodwill, stopped at Goodwill. There's this person like stumbling on the street. And so I said, if I'm listening to this presentation, you know, I was like, I know, like water's in my car, like, anything, like. Like, no, you have $1, something. Like. So you don't have water, you sure? Even if they know cold water, it's gonna be 105 today. It was so cute, but it inspired me, like, the last something there, and also while I was leaving. Do you know, this is something I was going to tell you, and I don't know if it's right. But there is a perception among some residents, they're the only ones that watch the drag around. They are the only ones. Well, they are the only ones that attend it. But there are tons of people, like, I don't think they're aware that there's a large, what, so I watch. About 90% of the time. But I wonder if there's a way to capture, like, viewership. Well, this is the second time I did, so it's not like. But in all honesty, okay, yes, there's something better, but probably not. I mean, it's.
There was, yeah, I mean, it was on at least 4 computer stations. As I walked over here,
Yeah.
you know, so there were 4 people in our office that were watching.
And you probably don't know me before, but I, you know, personally, I attend way more programs.
That's-
Remotely, So I feel like there are more people that are really appreciating it.
Well, and this is where we're gonna get proposed areas. Let's say the standard is you should have been a program on 3 years. But one in-person counts for 4. And then you can 8 or 2 in-person, that would be slightly exceeds expectations. Well, 3 in-person, yeah. Could that potentially sway you?
I've already been on it
Yeah.
and it's.
Yeah.
That was way me.
Yeah, okay, yeah. Oh, yeah. Okay.
But I think it would be more.
Yeah.
Things would be good.
People were asking a lot of questions, yeah.
Especially for something that
It's not really affecting our